So again, my name is Sang Sim. I'm one of the co-directors in the Gamma Knife Center alongside Dr. Ty Olson, who is a neurosurgeon. We opened up our Gamma Knife Center here at Monmouth Medical Center in April of this year, and we've been very excited about its introduction because it serves as another weapon in our armamentarium for brain tumors and brain lesions. So to speak a little bit about the origins of Gamma Knife and how it was initially invented, it was actually invented by a neurosurgeon, Lars Lexell, in 1967. So this is an old machine, old technology, and believe it or not, since 1967, nothing has really compared to its accuracy in terms of its dose delivery. So this is kind of the gold standard cutting-edge radiosurgery device. Every other unit that's out there today, including the CyberKnife, is invented or created to try to mimic or kind of emulate what Gamma Knife can actually do. So what Gamma Knife is actually 201 separate radioactive cobalt sources. And all these cobalt sources are kind of mounted in a semi-spherical position to focus at a single point in space. So all 201 radioactive sources point at a single point in space. And the idea of the Gamma Knife is actually to put the tumor or the lesion in that point in space. And so this is accurate. This is as accurate of a treatment device that no one has actually been able to surpass. We can actually shape the beam by using what are called shots. So these shots can be anywhere between 0 millimeters up to 18 millimeters in size, and combining different shots, we can create different shapes of lesions. We can create different sizes of lesions as well. The accuracy of this lesion is par none. It actually can treat and target lesions up to less than 0.2 millimeter accuracy. A dot with a pencil is larger than a 0.2 millimeter diameter, so this is accurate. With the Gamma Knife, since 1967, over 500,000 patients have been treated to date. We know this is a safe treatment. We have greater than 2,000 medical articles on Gamma Knife and its use, so we know how safe this is. And we have obviously a long track record with this unit. And again, this kind of shows you a diagrammatic depiction of how Gamma Knife actually delivers its treatment. So basically, the whole premise of Gamma Knife is that we put the lesion in the center of where all these 201 radioactive sources focus their beam. So if you can accurately place the head and the tumor exactly where each of these radiation beams are going to focus their tumor, then you deliver a very high dose of radiation without affecting normal tissue around it. So this is called radiosurgery. This is pinpoint radiation. The whole premise of that is ablating a tumor. So this is different from daily fractionated radiation, where you what you're trying to do with daily radiation treatments is you're trying to kill tumor cells without affecting normal cells. So you deliver radiation on a daily basis, allow your normal tissues to kind of recover on a daily basis. The radiosurgery premise is actually to deliver such a high dose that you ablate anything that you're targeting. So anything in the center of the beam that you're trying to treat, you're trying to ablate or remove. So many neurosurgeons consider this a neurosurgical device more so than a radiosurgical device. And that's, again, why neurosurgery is intimately involved in this procedure. So what we treat with Gamma Knife include, obviously, brain tumors. So that includes patients with brain metastases from various malignancies, meningiomas, benign tumors such as acoustic neuromas, pituitary adenomas, and in some cases, gliomas. Oftentimes, the gliomas are patients who have failed standard radiation therapy. We also treat functional disorders that include patients with facial pain, and another most common terminology for a facial pain is something called a tic or a trigeminal neuralgia. We have treated patients with benign essential tremors, so patients with either Parkinson's disease have uncontrollable tremors, or patients with actual diagnosis of benign essential tremors or familial tremors, where these tremors have kind of incapacitated patients from functioning. We've treated vascular abnormalities, including AVMs and cavernous malformations as well, with good success.